Hello everyone, I'm Dr. Shireen Saini and welcome back to our initiative What After Dentistry. As you all know, we are a team of dentists with healthcare management background and we are here to guide you and make you aware of the various career options in dentistry and healthcare. Today, we have with us Dr. Priyanka Kapoor, an orthodontist, professor and in charge in the Department of Orthodontics and Dentofacial Orthopedics at Jamia Millia Islamia University, New Delhi. She completed her BDS from GDC Patiala in 1999 and then completed her MDS from AIMS in 2006. And since then, she has been working in academics and research. She has more than 300 citations in her name and has a keen interest in evidence-based research, innovations in orthodontics related to customized triage, mobile applications, etc. She has recently completed her fellowship program in forensic odontology from SDM Dharwad and is proficient in integrating these two fields of dentistry to come up with various evidence-based research and analysis. She has also won prestigious international and national awards, including the one in the prestigious Moyer Symposium and Craniofacial Research Conference at Ann Arbor, Michigan, USA, and a chapter therein on Craniofacial Growth Series. We welcome you, Dr. Priyanka, to join us today on our platform and talk about the scope and opportunities in the field of orthodontics and dentofacial orthopedics. We welcome you once again.
Thank you, Dr. Shireen, for a wonderful, wonderful introduction. And at the onset, I would like to, first of all, congratulate Dr. Vipin and you both for a wonderful initiative of What After Dentistry. I think this is the first time I actually heard about such an initiative, and I really congratulate you because you are actually giving a direction to our undergraduates and postgraduates who, after clearing, we leave them at a certain point, we give them education, then we leave them there, and there you catch up, you catch them up. So I think that's a great deal of effort that you are making. So thank you so much for inviting me here. It's all my pleasure. And I think we can begin talking. Actually, I talk a lot, so that's okay.
That's okay. I think I'm sure this is going to be a great conversation that we are going to have today. So before we
Completely informal, Dr. Shirin.
so before we actually get into the formal discussion about this field, we would like to know more about you in terms of how has been your journey after completing MDS, and what were your struggles and achievements when you started working.
Well, if you talk about me, my journey has been quite dramatic. Uh, Lots of twists and turns. You can make a Bollywood movie someday out of it. But yeah, just to give you a gist, I started my BDS as a conventional, 12th pass out who had cleared her government exam and All India exam and went to GDC Patiala. And there from 1994 to 1999, I did my BDS, an excellent college with excellent amount of patients. I mean, like patients were just brimming there. So no dearth of clinical practice there. And then I don't know why I never pursued MDS. I never thought of doing MDS because maybe some other things caught up with me like marriage and all. So I didn't pursue MDS thought at that time. Then after 3 years in 2002, my friends they started motivating me who were already doing MDS in different government colleges. So they started motivating me that I should do something more with my life and I should not, become stagnant there. So they gave me their books, entrance books, and I started studying. And I was helped by my family here, and I started studying. And luckily, I got through PGI house job exam in January 2003. And there, I started gaining confidence that kahin to ho jayega, I'll just get through somewhere. So I joined the house job in PGI in January 2003, started studying again. And and the day I cleared my entrance exam at AIMS, that was a day that is imprinted on my mind and will always be on my mind ever. So, it's been a break. And then I picked up my books again, right from the scratch, from the first word to the last word. And then I cracked and I cracked. When I cracked AIMS, it was like I couldn't thank God enough. and everyone who have helped me through this journey. So yeah.
Right.
And after that, if you want to know, well, PG at AIMS, gives you a platform that yes, clinically, I had again no dearth of patients, no dearth of a variety of expertise that I gained there. I had an excellent mentorship there. I had an excellent platform there because AIMS doesn't just give you formal education in MDS per se. You have all kind of opportunities for personal growth there. You have all kind of societies there you can be a part of, and you can see the amount of talking that I do. So I would have been a part of few of the societies. And then I was also interested in all the other activities like gym activities, swimming and stuff. So you have all those for your overall development. I mean to say, it is a very, very good platform. So from there, I went on for 3 years. I did some private practice after my MDS, but then academics was always in my heart. And so whenever this opportunity came, I applied. Assistant professor opportunity came from Jamia Millia Islamia. They were starting a relatively new college, and so they had advertised, and I just applied there. I had, I think, 48 candidates, amongst which I was able to get. Again, I was very thankful to God at that time because that was my entry into academics. Once again, after a gap of 3 years, so 3 years I think has been a very a very important part. 3 years, then 3 years. So yeah, then I again now ever since I'm in academics, no break thereafter.
I think that's a great journey because, once you get a break after, say, completing your BDS, and then to start the study all over again, it's again a hassle, and you really don't know from where to start. You're so struggled, you're so confused, but then you again picked up and you cracked aims. I think that's commendable. So,
One more thing I want to say here, that when I picked up my books again, I had a 1.5-year-old child by that time. And I had to leave him to study because I used to study around 14 to 15 hours a day. And I had fixed up some time, stipulated time in a day, then when I would be with him and not with the books. So it was very, very difficult. So now if the students come up to me, because all the students that I'm teaching now, they definitely in final year they have this sense that they have to prepare for MDS. So I tell them, this is the best time to prepare for MDS, final year and internship. Don't get into the hassle which I had been, because not only me, I actually implicated that on somebody, a child also. So don't do that. Do it at the right time, at an early time when you are right there studying that. So it's more, you're more in sync with it at that time. Yeah.
I think it's easy to catch up also, to grasp all the concepts once again, because getting a break and then with a child, I can totally comprehend how difficult it is, because my son is also he's also like 4 years old now, but then it was difficult for me also to start off with work when he was around 2, and then yeah, I can totally comprehend with that how difficult it has been. So we really, it's commendable what you have done, and we hope to see that more of your academics, and we talk more about this as the session goes on. So I would like to know, I remember like when I was doing dentistry and today, I'm sure the education system might have changed. So how has the education system changed all over these years? And also I would like to know, how has COVID impacted this education now?
The education system has, I think, completely changed. It's not about the amount of time that you're spending in an undergraduate or a postgraduate course. It's how the education system is being imparted now. It's completely different from the time when we were studying. I'm talking about, like, I did my BDS in 1990s. So 1999, I cleared my BDS. And at that time, computers, I couldn't even find one computer in my whole college, let alone the administrative part or the teaching part. I couldn't find any computer there. And then when I went to my MDS 2003, I joined in July. And mind it, till that time, my house also didn't have a computer. And then first day I was told, and very, very logically, I was told by my guide that you need to have a computer in your own room if you have to do this MBA, because that's the first key to education. to information seeking, and you need to learn first, get a hands-on experience on it. It's not only preparing presentations, first get a hands-on experience in it. And so, at that time, there used to be 4 5 computers in a computer facility room that was designated a name. So you can imagine the amount of MD people who were doing MD, who were doing MDS, and they had access to those 4 computers. So we used to, to learn computer, we used to go there and we used to fix up a time like, okay, half an hour for you, then half an hour for me. We learned like that. But then after 3 years, it was not a problem at all, because we learned everything: how to prepare presentations, how to look for articles, how to read those, how to apply those. So, and that thing has, I think, in this COVID time, like I'm coming back to this COVID time, I think that has gone from not one house to every house. It has gone from one mobile to every mobile. Every child has an access to it now. Don't talk about the professional people, talk about everybody. Now, simple, a 6-year-old, 7-year-old also knows how to operate it. So I think if you talk about change in education, that has been instrumental in a complete change of education, how we are imparting education. And specifically to the dental perspective, if you see, there is one thing that I definitely feel that for students, dental students, the one thing which is very important is, dealing with the patients. That has become slightly lacking in these times, but we can't help it because it's not possible. But apart from that, for an orthodontic perspective, we have a very perfect kind of a record system. So everybody knows that orthodontics, they prepare their records very diligently, and we have radiographs, we have photographs of almost every case. So when we are trying to teach our students now, we don't just tell them to, okay, this is a presentation, this is a topic, like even if it's an oral habits topic, it's not that we're just going to tell them pointers, okay, these are the pointers, you should know these, in this tongue thrusting you should know this, in this you should know this. We don't go like that. We first will show them a case at the first go, and then we will ask them, okay, what is the problem that you feel is there in this? Then slowly and steadily we will tell the patient's history to them. We are trying to simulate the patient experience with our own slides, with our own records, as much as we can for our students. We can't help them more than that, because any kind of records, any kind of history taking, they cannot replicate a patient, definitely. But yes, to what extent we can help them, we definitely help. So that's what is coming up. And not only in orthodontics, I think every specialty is coming up with this problem-based learning now. And you would be happy to know that in recent years, because now we are in touch, I've been in teaching now for almost 14 years. And I have seen this change myself, that even the entrance exam questions that are there, they're not just, okay, in which year this was given. We are invited to, write the MCQ questions and all. So we are being specifically told that what are the kind of questions they expect from us. And it's more of problem-based learning. They are telling us that you keep an image and then you tell us, then you write a question about that. So, it's more visual, it's more interactive, and it's more problem-based. So I think that is what we are coming to now in the dental education.
I think
And
that's
I think right.
yeah, I think this is completely needed also, because I remember we were, it's more was theory, and then of course in the clinicals when we had to go, we had to do it on our own basis. Yes, our faculty and the professors were there to help us at every stage, but then that, to apply the theory into practicals or clinicals, that was something that we did on our own, study and then apply it. But I think the way now teaching is being implemented, like you said, interactive based learning, problem based learning, I think it's very very important for the new graduates, because they need to know that what is the case, what are the situations, and how better can you handle such kind of situations. So that's I think very
I
much
think
needed.
you Shireen, know that when you read the theory and then when you come by the side of the patient the situation never matches.
Yes, exactly.
You have to improvise. You can only improvise if you know, okay, this is possible, you can do this. So yeah,
Yeah,
problem-based
exactly.
learning is the key.
I think that's very, very important, because now everywhere it is more of evidence-based and, problem-based learning, which people are trying to adapt. And this is very important to dentistry as well. So yes, I think this is completely true. So we would like to know that, when a student wants to pursue MDS in orthodontics, so what should they expect when they are, getting this, or they want to get into orthodontics as a specialty? What should they expect from this field while they're pursuing MDS, and how is the student life?
Well, student life is extremely hectic, and rightfully so, because I feel it's not only for orthodontics. I feel when you get into a master's degree and you are attaining a level which is much above than what you were at the undergraduate level, the amount of perseverance and the amount of honesty that you give to that particular time is so very important for building the rest of your career thereafter. If you don't fall in love with your subject, in those 3 years, you cannot just continue. Half-hearted attempts can never make success. And it's not only about success, it's about the learning experience. Those 3 years can give you so much of learning. I have seen, now we go and take exams, and we are interacting with students not only in India, in different colleges, but we are interacting with students worldwide. And there has been a change. There is a change everywhere. Okay, people. There will be a section of students who will be completely committed. There will be a section of students who have just come from the pressures of their families and stuff. There'll be a section of students who've just come for the degree and they have to put that degree in front of their clinic and stuff. So the motivation behind why you're pursuing that MDS is really very important. But then there's a minor role that the mentors can also play. Sometimes you might just come to us with the thing that, okay, I have to do MDS just for the sake of it. But then we might generate that much of interest in you that yes, you might think these 3 years, oh, I have to do everything possible in this earth. And I'm more I have been taking lectures, I've been taking workshops for so many students, and they come up with such beautiful questions. And the first question that they ask, how we should motivate ourselves, and which is very, very important. If they don't motivate themselves, first of all, they have to fall in love with the subject. Second thing, which is most important in an MDS degree, is falling in love with your thesis. Very, very important. I have when I teach about thesis taking up, even for guides, I have been giving pointers. When the MBA student comes to us or gets admission anywhere, there are few strong points of that candidate. Every child has some strong points. There is no child without any strong point. So in the first few, maybe 1 or 2 months, we can recognize their strong points. Some people are very good with technology. Some people are very good with research, or they can understand that article that you've given, so they can understand that, that. Some people are very good with the basic sciences. So I'm just taking an example of orthodontics, right? How you can incorporate, you can give them a thesis topic just related to that. There's so many different dimensions in which you can go. But if you try to give a technology expert a topic in basic sciences, oh, you can't make him do. You will continuously be after him to do that and finish that, and that's not possible. Let the child enjoy what he's doing. That's most important, and he'll give you the best results. He gives you the best results. So that's what I feel is really important while doing it. The motivation factor, both on the student aspect as well as on the guide aspect.
Exactly. As you've put it very correctly, it's very important. So all you students, if you're listening to the session and you think on doing MDS, find out that niche, where you are good at, and that can be anything, and try to incorporate that particular niche with your subject of interest. It can be orthodontics or any other field of, dentistry, but try to amalgamate these two interests, and then I'm sure you would come out with beautiful thesis, as Dr. Priyanka correctly said. And we need mentors like her in the industry, to identify and, to motivate students that this is what you're good at, work on this. So thank you so much, Dr. Priyanka, because this is something which, I have not seen so far as of now, till date. So I'm
No,
sure
but
you're.
these days, Shirin, many PG guides are actually following this, and they are realizing that they're getting very good results. And it's not only me; it's their own realization. It's everybody's own realization. Also, it comes up by so many years of teaching. They come up with all this, but it's really important. And yes, you talked about amalgamation. That's one thing I really feel is very important. Don't limit your brain to just one discipline. You have immense potential in so many different directions. If I can do a kind of a fellowship in forensic odontology in 2018, after I think 12 years of being in academics, I must have felt something that yes, you can kind of merge that field into my field. I would definitely be doing something in basic sciences very soon because I am very much interested in biomarkers, and once I'm interested in something, I would like to learn more about it. I would like to integrate that in my profession. Taking my example only, my thesis topic was on biomarkers. I'm so thankful to my guide to have given me that topic. For the past 14 years, if you look at my resume, I have almost built 70% on that. So it's how you perceive your interests during your PG time that can take you way forward after that.
Right, exactly. So that's, I think, very, very important. And that's how you grow also, because when you keep working on something that you love, or that you're passionate about, I think then you don't have to work, like, you're not
It's
working
not work.
actually. Yeah. And
Absolutely.
there's nothing like I have to work, I have to go to work, something. That there's nothing of that sort. Yeah, you just
No,
love
no,
doing that all the time. I
it never has happened even for one day.
Yeah, I can
I'm
totally
pretty lucky.
comprehend with that. Yes. So now talking about once you complete MBS, and then how do they start their career in orthodontics? What are there multiple career options or multiple career paths that one can choose, or is it just like that one can either go into academics or they can work as a consultant for as an orthodontist?
See, it's basically now it's a demand and supply thing also in colleges, if you talk about, because not many government jobs are being advertised time and again. Like we have few in Delhi which were advertised, and even in my own institute one is being advertised, but it is not, the selection committee has not happened. So there are few which get advertised time and again, then you get huge lot of applications for that. So don't just keep on waiting for the right opportunity to come. Grab all the opportunities that you have. Don't miss out on any opportunity. You can switch whenever you want. Like I switched from 3 years of private practice to the academics because that was deep down in my heart. I had to go ultimately there. So you can take different career paths after you complete your MDS, and you should start preparing. I think 3-4 months before you start giving your exam. Students these days are very very conscious. I'll tell you, they start asking us, all the teachers, much before they appear for their exams. Okay, what are the opportunities, how we can go about it. So one is advertisements that they come in the newspapers and you have to follow them up, and they have their own criteria. Some will have fresh, you can just apply as a fresh postgraduate, and the others will have, okay, as an assistant professor you have to have 3 years of experience, only then you can apply. And that experience is also teaching experience that they count. So for a teaching experience, definitely you need to have a job somewhere as a senior lecturer or a fresh assistant professor. So those kind of criteria, if you have in mind, then definitely you need to have a teaching background if you plan to do so. You can go to different colleges, you can maintain contacts with the different guides and the managements. You can keep on putting resumes there. You might get a call, but then that call, again, you have to wait for that call. Till that time, if you can, orthodontics is one thing where you can club your private practice with the academics. if you are not in a government setup, because government job definitely you cannot do a private practice along with a government job. But apart from that, if you go for a private college, you can open up your own clinic, a purely orthodontic practice also, or you can open a general dental practice. Some people are still doing exclusive orthodontics. I know of quite a few people who are still doing exclusive orthodontics. And for them, they are not just situated in one clinic, but they are as a consultant in various dental clinics. But for that consultancy, I'll again give you a very small tip. You should always maintain a kind of a communication with your seniors, with your mentors, because they are the one who can give you leads. Quite a few of them. Some people might be going abroad, they might be leaving their practices, they can connect to you. And some mentors might be having, because they're seniors, so they might be having connections where you can be posted as a maybe in some hospitals as a consultant. So those communications become very important at a certain point of time. Apart from that, only private practice or these college job, if you are not lucky enough or you don't want to pursue that, you also have research opportunities. A lot of research opportunities are there. There can be various funded projects that are given to various faculties all across India, and they have huge funding in those projects. And they advertise the GRF posts like the Junior Research Fellows or Senior Research Fellows. So when they get advertised, you can apply for the research. So you can have a research exposure in that. Then you can also apply for fellowships abroad if you want. You can choose a particular domain, and you might not be able to build up a project all on your own just after doing your PG, but you can again contact your guides or your seniors and you can prepare a project. And you need recommendations from your institute, previous institute, or the current employer where you're working. So again, maintain good connections everywhere. So be at the best everywhere. So yeah, you have a lot of opportunities. There's no dearth of opportunities anywhere.
I think that's correctly said. So whenever you want to grow, every one of you need to build up on your contacts. This is very, very important. We've been talking about, this in almost every session, wherein you need to work on your network of, either with your faculty, your friends, your seniors, and various other people in your industry. So it's very, very important that you have your own network of people around which can help you to get around, get the various opportunities. Like as Dr. Priyanka correctly said, you can work as a consultant, you can work as a academician, you can work in the research area. So yes, there are a lot of opportunities, and it's not just you need to just get into the clinical side of it. You can do multiple things, and of course, as Dr. Priyanka, she, like what she says and what she has done is she also tries to integrate the two fields of dentistry that she has pursued, the forensic odontology and the orthodontics. So you can come up with your own thing and start working on it, build on that. And of course, in your career, once you start growing, it is definitely going to lead you somewhere wherever you want to reach. So I think that's very, very important. So I just wanted to know, if somebody wants to work outside India, is the MDS in orthodontics valid outside India, or they have to pursue some, generally, like while a BDS, when they go outside India, they suppose they're going to US, so they generally pursue DDS over there. So how is it with an MDS orthodontist if they want to, work outside India?
If you want to work outside India, this degree might not directly earn you employment there. So you might have to clear their licensing exams, which are applicable to that particular country or continent. And in Dubai, definitely, a lot of my friends have gone, and there the exam is just one simple exam that they have given, and they got it was an MCQ exam. So I think there it is relatively, I must say, that you can, if you want to go and practice there, there you can clear that exam and you can directly start practicing. But the MOH, the Ministry of Health from their UAE, there also initially when I cleared for many years, I used to get their calls. So I think they are very they conduct these interviews very often, and they come to India and conduct it. So I think there the situation will be they will have some experience, like of 3 years. They need that experience after MDS, and then you can apply, and then their ministry rules are going to apply on that. But yeah, directly if you say this particular degree is not going to earn you anywhere,
Yeah,
you have to play there.
correct, correct. So we also see that nowadays we have so many hands-on courses on orthodontics, right? So like a BDS can pursue these hands-on courses and then they can start practice orthodontics. What are your thoughts on that? Because many of them are doing it.
That I'm completely not in favor. Neither is my national society in favor of it, and I'm completely in sync with them. Because when you do, as I said in my very first 5 minutes, that if you're not in love with what you do, with your subject of post graduation, then you might not be able to attain the level of expertise, the level of success that you want to. And these kind of courses are crash courses, which I am not completely in favor of, and I would not like to talk much about it because to each his own, but not for me. I am not completely in favor.
Right, exactly. Because I feel, what you learn in 3 years, you can't just compile that in 6 months or 7 months or even in a year, because that's a very specialized.
That there's a whole process. You are made to do thesis, you're made to do library dissertations. They hold meaning. That thing hold meaning. These kind of courses, they'll just show you, maybe, I don't know how they're conducted, I've never had an experience of it, but maybe they show you a few cases and then they tell you, okay, this is how you bond. Bonding is not is equal to orthodontics. It's not. You have everything pre-customized now. That doesn't mean that you just put it on the teeth and it's all done. So, yeah.
Correct. So, what are the various new technologies or developments that are happening in this field of orthodontics and dentofacial orthopedics? Would you like to talk much, about it? Because this might help the pursuing MDS graduates to focus on the new advancements that are happening in this field.
I'll focus on two different aspects majorly, and these two different aspects will be one on the research aspect and one on the clinical aspect. So when I talk about the research aspect, if you talk about the post graduation, we have seen a complete change. Earlier we used to do, if you had to do a review or you had to look about, if you had to look about a certain solution to a clinical problem, so what you would do, you would just search the internet and you would type a similar situation and you would look for answers, and then whatever 3 4 things came in front of your screen, you would say, okay, this is fine, I can go with this particular option. But now, if you want to look for an option for your clinical question, what would you do? You would go to a good quality systematic review, you would go to a good quality meta analysis, which has compiled all evidence in a particular critical systematic way and has given you a single answer. This is the answer, and this is the level of evidence that supports this answer. So that is the correct way of research to any clinical question of yours these days. So this, I have seen that there's a complete change on the research aspect. You just don't go for any kind of personal opinions. Earlier we used to have a personal opinion ke 14 साल से कम के बच्चों में we should not put braces. That was a personal opinion. But if you now look at the evidence, it says something else. So what I mean to say is that the research has seen a complete change now. Now, if you talk about the clinical aspect, there's so many different domains that are coming up. One is, I have recently published a chapter on recent advances in orthodontics. It's a comprehensive chapter, and very recently, 2021, it got published. So I have compiled almost everything in that, whatever recent is coming up. A lot has been coming up in terms of wires, brackets, definitely everything pre-customized is coming up. So if they want to take up any research topics or thesis topics, they can take up on that also. Lingual orthodontics or pre-customized brackets. So anything they can take up like that. But The other technological advancements that are coming up are majorly the artificial intelligence, the big data, the machine learning. That is really coming up huge in these COVID times, definitely. Because now what we are doing is we are trying to compile all the patient's data that we have into the algorithm or the machine learning models, and we are trying to come up with particular answers, that can lead up to particular situations. So these kind of, and you will see a lot of new research articles coming up in these domains. Apart from that, there's so many mobile applications that are coming up for self-assessments, because COVID times has seen a lot of patients not wanting to go to the hospitals, or even the hospitals not wanting an influx of so many patients. So we are into self-help mobile applications also. And luckily, my team also developed an OSA, which is an obstructive sleep apnea risk mobile assessment application last year. And we didn't know about this COVID time would come. We had been working around for this a year before, but then this just came in the middle of the COVID time. So then we started to propagate this as a self-assessment app for the OSA risk, and we have been getting very good results about it, because this is one area which is not very touched upon in any branch of dentistry, and we need to incorporate it because it has so many different cardiovascular and different neurological complications later on. So we decided that this can be used as a self-help mobile application, but we are propagating the other mobile applications also which are coming up. It is not only for the diagnosis but also for the treatment planning aspect. All these mobile applications are there. Apart from that, you have patient education applications which are coming, so they can help patient, not, they can just identify, okay, this is my situation, how to help myself in this situation. So those applications are also coming up. Patient management softwares are coming up, which are very, very important. Remote management possibilities there. Patient is sitting at home and you can remotely manage their tooth movement and that. Those possibilities are also there. Then you can also have the applications using the social media. They have kind of, again, use the artificial intelligence and everything in that, to see what kind of questions patients ask on the social media sites, what kind of problems are mostly referred to by the patients, and what kind of solutions come up. Do they also look for education for orthodontics on the social media, and what are the various sites that they usually refer to, whether it's Twitter, Facebook, or the academic social networking sites like ResearchGate and all. So, all these applications are very, very new, and they're really coming up in a big way.
I think that's amazing. That's really great, because so many advancements happening, both on the clinical as well as the research area. I think this is something that one should definitely explore and work more on this, and this will also help them to gain a lot of experience and also apply this when they start working after completing their MBA. So thank you for elaborating it so very nicely, because I'm sure many would be getting ideas for their thesis and what all they can do in this particular field of orthodontics and dentofacial orthopedics. Yeah,
they can refer to the chapter also.
Yeah, sure. I will exactly. I will like to get that link if it's there online. I will refer that link in the description, and one can check out that research paper that you have already published. I think this is definitely going to help out all the MBS graduates. So, what are your last thoughts for the students out there? What are the scope, and what advice are you going to give to the students that are listening to us today?
The students, my one and only advice is that be motivated, and there is no dearth of opportunities in every area that you go. You just need to find the right time, the right connections, and the right opportunities to take you ahead. Don't miss out on any opportunity that you have. I would also like to emphasize, which I personally integrate in my own practice a lot, that don't just limit your brain to your own discipline. Try to feather out, try to go in different directions. And in every direction that you see, you will find one opportunity. You integrate with psychology, you'll find so many opportunities. You integrate with basic sciences, you'll find a hell lot of opportunities. You integrate with health informatics, which Dr. Shirin is specializing in, you will find amazing opportunities. So I mean to say, don't just limit yourself. There is a whole new world out there to explore, and you are currently residing in a time when this world has become very small because of the online platforms. So you can avail any opportunity. You can go for courses, online courses, and they're very good courses. If you want to start with the research itself, you can go to Coursera, you can go to the Stanford courses. Amazing courses you have. So start somewhere. Start somewhere. Just think about it, how to integrate with your own discipline, and the world is the limit. So I think that's my take for the students. And for there's one thing that I feel that the assessment form of our dental undergraduates and postgraduates have been quite similar for the past many years. I think that needs change. We should have more credit-based systems, and like I'm saying, if I'm emphasizing on integrating with so many different specialities, I think the students should be given credit for it. If they are pursuing something which is apart from there and they're trying to integrate with their own profession, they should be given some credits for it. They should have some incentives, some motivations for it. Yeah, so I think that is one thing that is a take for the administration or the authorities who are actually, who can make a change in the policies and governing.
Right. Exactly. This is very, very correctly said. I think there's, this time now is demanding that, dentistry is not just the clinical practice that was being done over the years, but then you can, as you said, you can integrate so many other disciplines of healthcare into dentistry and then come up with something new and innovative in this field, which is
innovation can be one thing which can be taught very early. You can give credit points for it. Any small thing that the child comes up, and believe me, they have immense potential. You can't even imagine how much potential they have unless they don't explore themselves. There's one thing that comes to my mind always. I read it somewhere long back that for students, they don't care how much you know, but they do know how much you care. So yeah, that applies.
Right. I think
we have to concentrate on students as a whole.
Right.
Only as
exactly. And we need professors and teachers and mentors like you in the industry to motivate students to come up with new ideas and tell them that this is not one thing that you should do in life. There are so many things that you can do, and try integrating all of these together in your career of interest or area of interest that you want to go into. So yeah, thank you so much, Dr. Priyanka, for elaborating it so very nicely and coming up with so many ideas, so many innovations in this field of orthodontics and dentofacial orthopedics. I'm sure all the students out there, they would be now motivated and inspired to do something new out of it. So thank you so much for coming on our platform and sharing all the wonderful insights that you shared with us today. And for all the audience out there, if you're listening to us, then thank you so much for patiently listening to our session today. I'm sure you would have got new ideas and new things that you can work on to grow yourself in this field of dentistry. So thank you once again. I will see you in the next video. And of course, please subscribe. Subscribe kar do, free hai. We see that a lot of people view our sessions, view our videos, but you're not subscribing. So please subscribe, like, and share, because this is the only way we get encouragement to do more of these kind of sessions for you guys. So thank you, everyone. I will see you in the next video. Until then, bye-bye and good luck.